in this session, we're talking about AstraZeneca's Young Health Program, which is going to be launched. Their partnership with UNICEF. The main concern of Young Health Program is about preventing NCDs or non-communicable diseases all around the globe, especially for young people. And what do you think are the major health issues that adolescents are facing in our region, especially in our country, Indonesia?
10, 20 years ago. So what's happened in terms of the disease is basically the infection disease was dominating. And right now, 70% of the disease is basically the non-communicable disease, while actually the infection disease is still there. So we are facing the double burden, which is where actually the government and also the society need to deal with the non-communicable disease, while actually the infection disease is still there.
Tobacco is one of the risk factors to the main groups of NCDs. I can tell that this is very connected how the tobacco control issue and the NCDs that we are talking about today.
When we talk about what is the problem or the major health issues specifically on mental health, it's basically awareness in our society is still low, especially in Indonesia and maybe in other still developing countries. So just addressing the problem itself is still a homework for a lot of us, all of the stakeholders, especially also young people who also being the most vulnerable group, which most prone of mental health issues.
So we can see that even from this different perspective, different angles, not only about the health itself, but also the economic and also the environment, it really affects one another. And having these young people being part of our movement is really a great factor for us to keep going.
What is the approach of AstraZeneca's YHP with UNICEF in actually trying to tackle these issues?
The Young Health Program in Indonesia is run and also managed under supervision, also under umbrella of the Minister of Health under the MOU between Minister of Health and also AstraZeneca. What actually the Young Health Program is looking like.
In addition to the research itself, we are here in UNICEF Indonesia, we do have the U-Report community that could be an advantage to this partnership between AstraZeneca and UNICEF Indonesia programs. It really has the main three components about the awareness itself, including how we can tap into the research for having these young people being able to speak up more, and also empowerment until finally these young people could implement their action as well.
I'm very much interested and excited about the collaboration. And by seeing the facts that hundreds and thousands of people who died caused by smoking in Indonesia, and how often do I hear about my friend, family members, and people around us who are sick or died from smoking-related diseases, it really reflected on how urgently it is needed for people to learn better about NCDs.
So actually, what will be the role of young people to work in this partnership?
I believe that young people born as natural leaders, as the adults or the facilitators needs to help them to empower themselves through capacity building, leadership training. It's very useful, and make sure it is delivered in the way that the young people can understand.
Young people themselves are actually really our equal partners. So that's why we believe that having this AstraZeneca and UNICEF partnership on this Young Health Program is really an initiative for us to be able to equip young people, for those who are not having enough exposure just yet on these non-communicable disease issues, and also at the same time to really give the platform for the young people to speak for themselves.
We need to be able to really maximize the impact of the young people, to really maximize the impact to the economy, to impact to the social, to the politics as well in the bonus demography period.
We can get a sense of connectedness, relatability, and belongings to the program, as well as the other young people as the target of this program, by empowering the young people itself. So they will be easier to engage and want to be involved, and they listen more to the words of young people themselves.
The more important question is not only how young people can support the projects, but also how young people can be supported and provided, so we can fully support you back, because again, it's partnership.
Pemuda, harapan bangsa,
pemuda
pemuda, cegah penyakit tidak menular.